The Coalition of Medication-Assisted Treatment Providers and Advocates, and we represent opiate treatment programs, including hospitals as well as freestanding programs across the state. And I personally am also a provider. Thank you for coming today to hear why it's so important that the Office of Medicaid Inspector General, the OMIG, this Medicaid audit reform bill is to be included in the final budget. You will hear from stakeholders, legislators, associations, including this list of 50 providers who are all in support of this important piece of legislation. And just this morning, a letter went to the governor, including all 50 of these providers that support this piece of legislation. Everyone here supports OMIG audits that guard against fraud, waste, and abuse. But the current OMIG process is unfair and harms the Medicaid system it is intended to protect. A prime example of this is the audit of one of our member programs, an opiate treatment program which had a total audit finding of $400, which was based on technical and clerical errors, which resulted in close to $8 million in disallowances, the disruption of services to 1,500 patients at high risk of overdose, and when that clinic closed. When that happened, our association, working with all of our partners here, we turned to the bill's sponsors. And I am so pleased to introduce Assembly Member Amy Paulin, Chair of the Assembly Health Committee, who's worked tirelessly to see this legislation happen. Thank you so much.
Sorry.
It's all right.
All good.
All good. We're all friends here.
Team.
We are a team. And only with that teamwork are we going to be able to get this bill done. And we are a team represented here by legislators and our partners in the healthcare arena, the not-for-profit arena, who have been treated unfairly and bureaucratically. It is a worthy goal, as we all know, to get rid of fraud and abuse. We all want to see fraud and abuse out of the system. But what's happened is that the mechanisms that are being used delve into these technicalities, and then they blow up into major fines. And the major fines and punishments are forcing providers, sometimes a provider that's doing work, as you'll hear soon, that no one else is doing. So it's making it impossible for these providers to do their jobs and at the same time ensure that we have the services that we need. When we look at some of the providers on our list that are working with us, it's little groups, you know? I mean, I'm picking out a big one, the Mental Health Association in New York State. Who wants to see such a technical error result in the mental health organizations when we're in a mental health crisis go out of business? Nobody. New York Disability Advocates, come on. It's an absurd thought that these little groups that are underfunded to begin with are causing such havoc in the system to be warranted to go out of business because of these technical errors. It's just an absurdity, and we have to fix it. We have to ensure that these providers stay in business, that these services stay in business, that the errors are for real fraud and not for made-up fraud, because otherwise we're going to see good providers go out of business, and perhaps even fraudulent ones stay in business. So its time has come. We've seen the errors of our ways. We've seen the errors of the OMIG, and we have to fix that. And with that, I'm going to turn it over to my good friend and partner in this endeavor, Pete Harker.
Thank you so much.
Thank you, Amy.
Thank you very much, Assembly Member Collin. I don't know that I'll be as polite as Amy was. Our human service providers that take Medicaid, and you can see from this list, it's a broad array of human service providers, have been under assault, nothing less than assault. Has it been the decades of disinvestment? Has it been rampant inflation? Has it been COVID? Has it been the staffing crisis? All of those are challenges that they've dealt with, and they've dealt with skillfully and with courage and with aplomb. What the assault is from the Office of Medicaid Inspector General. So rather than hiring clinicians and people to address the programmatic mission of the agency, they're hiring bookkeepers and accountants to spend countless months and months going through these audits from the Office of the Medicaid Inspector General. Now, the Office of the Medicaid Inspector General was formed in 2007. New York was a very different place, and there were not checks and balances in place, and there was rampant waste and fraud and corruption. That's not this New York. You know, this New York, if you want a penny of state money, you have to spend weeks and months, as you should, in triplicate, justifying that money. But these audits have not changed their tune, and it has been mentioned by both of the previous speakers, just hounding agencies over clerical errors. That was never the intent of the Office of Medicaid Inspector General. They are not the police of administrative error. And so by using some of the techniques they do, extrapolation and other things, you heard the prime example. One agency, like in the height of the opioid crisis, where we need every treatment slot available, was given over a $7 million fine for $400 worth of administrative errors. That's insanity. Like, how can we justify that on any level? And that's why this bill is so important. And that's why I'm glad that both of our houses, the Senate and the Assembly, have put it in our one house. This bill has been vetoed twice in the past. And the fact that we're not going away on this thing shows how important this is. And we're really, really encouraging the governor to take this up in this budget. Partner with us. Let's reform the system. Let's ensure we don't have waste, fraud, and abuse. But let's protect our providers from this onslaught of the administrative police. Thank you.
So thank you so much. Thank you to both of our bill sponsors. We're going to now hear from Lori Cole, who is the Executive Director of the New York State Council for Community Behavioral Health Care, representing 150 mental health and substance use prevention, treatment, and recovery agencies around New York State. And I want to personally thank Lori for her leadership and all the efforts that she has on this bill. Thank you.
Thank you, Allegra.
She's back.
I'm back. Good afternoon. I'm Lori Cole. I'm here today representing 150 mental health and substance abuse providing organizations, that is community-based organizations, that have signed on to this reform. I also want to correct the record and make sure you understand that the list of organizations that has been shown, this is a list of coalitions and associations that all represent hundreds of providers across the Medicaid care continuum. And so all of these names are the umbrella organizations that represent hundreds of Medicaid providers. Okay, it's both pages. For over a decade, Medicaid providers, to include thousands of community-based organizations that form the backbone of the New York safety net, have been begging and pleading for basic fairness and balance in the OMIG audit reform process. Our intention is to support OMIG in its mission to root out fraud and abuse, while also obtaining fairness and balance in the audit process. I'm going to call them tactics. I'm not going to be as polite as others. I can afford to be. The tactics currently used by OMIG to generate hundreds of millions of dollars for the state from honest providers who have not committed fraud cannot stand. OMIG punishes providers for employing human beings who make human errors that have nothing to do with whether the service was provided or whether the quality of care was acceptable. Medicaid services provide vital and often life-saving care to millions of New Yorkers each day. Access to care for New Yorkers who rely on these services must be our top priority. Right now, Medicaid safety net providers live in constant fear of an audit that will unfairly take them out at their knees. In this situation, no one wins. Not our government, not our taxpayers, and least of all, Medicaid members. Transparency, fairness, and balance must be the new normal in the OMIG audit process. As I said, we've been making this request for close to a decade now. Today is the day. Today is the day we call on lawmakers, all lawmakers, and we stand side to side by those who support us to deliver meaningful reform that will ensure the Medicaid audit process is not just a game of gotcha, in which the rules of the road are largely one-sided. We need a Medicaid audit process that New York can be proud of. And we are counting on Governor Hochul in partnership with the leaders standing beside me to deliver this reform. Thank you.
Thank you, Lori. We're now going to hear from Michael P. Scott Christensen, Special Counsel at Barclay Damon. Michael is a subject matter expert with clients across the Medicaid healthcare landscape seeking fairness. Michael is a member of the New York State Bar Association Task Force on OMIG Reform. Thank you, Michael.
Good afternoon. I frequently represent providers in payment audits, including those conducted by OMIG. And I've had the privilege over many years to work with Medicaid providers and assist them in handling these audits. And over the course of my work on these audits, a certain theme developed very quickly, a familiar David and Goliath theme, if you will. In my experience, where all the work that goes into an audit and its response is burdensome, that is not what gives providers and their attorneys pause. The real threat these audits represent is that despite many providers' earnest efforts to run a safe, compliant organization that delivers high-quality services to patients, OMIG will identify and focus on a technical issue with the provider's paperwork. That OMIG will determine that the paperwork issue is a reason to claw back providers' claims payments, and that OMIG will not only claw back the affected claim, but infer this issue is present throughout all the provider's paperwork and all of its claims, and therefore claw back claims payments across an entire period of time. That period of time can be 2 or 3 years worth of claims. As a practical matter, this means that providers may be required to pay back thousands or even millions of dollars based upon a paperwork issue found in a small sample of claims. There is often no dispute that the provider's operations were substantially compliant. There was merely administrative oversight and a whole chain of operations that went into delivering those services. The provider did everything right except this technical error. Maybe a rogue employee, despite being trained to do so, one afternoon inexplicably did not file a signed copy of the patient care plan, or maybe it was misfiled. That issue may not even be related to the organization itself. At times, these issues are caused by those external to the organization that may have failed to do something that's part of the program. Often there's no dispute that this was a mere mistake. There was no improper motive. It resulted in no extra profit to the provider, and it resulted in no extra expenditure to the Medicaid program. A small lapse, but the provider is then forced to pay back thousands or millions of dollars in claims payments. OMIG's recent practice has been to, at the conclusion of an audit, offer a lower clawback amount to resolve the audit, a settlement offer, if you will. If the provider does not accept and chooses to exercise its legal right to request a hearing and determine whether the clawback amount is appropriate, then that lower amount is withdrawn and the provider is threatened with a higher clawback amount. The spread between those two amounts can be quite significant, at times hundreds of thousands of dollars, and we've seen more. This has a chilling effect on providers' ability to challenge the accuracy of the audit results. And this is especially difficult because OMIG is often afforded the benefit of every doubt. When at hearing, if there are two reasonable interpretations of a requirement, OMIG's interpretation will typically win out. This generates even more difficulty for providers because often these interpretations are not always clearly defined ahead of time. The Medicaid program requirements are complex and extensive, and for the provider, ensuring they interpret every requirement the way OMIG inevitably will is a terribly fraught activity. Providers don't get a second chance to please OMIG. Their documentation is already created by the time OMIG shows up. The provider can't go back and conform their documentation to these requirements. These concerns were significant enough that the New York State Bar Association's Health Law section convened a task force to look into these issues. While I do not serve as a task force official representative, I've been informed that it has now passed a resolution by the task force concerning fundamental unfairness in OMIG's process. These are the issues we've observed over a long time, and the attorneys who work on these audits see these issues time and again. Thank you.
Now we're going to hear from two of our key supporters and have also worked so hard on this bill. Thank you so much, and we're going to hear from Senator Natalia Fernandez, who is the chair of the Senate Alcoholism and SUD Committee, Substance Use Disorder Committee, as well as Assembly Member Harvey Epstein, who is a key supporter and a member of the Committee for People with Disabilities. Thank you.
Good afternoon. Thank you so much to our coalition members, to my legislative partners, in continuing to fight for this, I feel, so obvious problem. The Office of Medicaid Investigations has been, in essence, trying to do the right thing in weeding out fraud, which we know is bad, but when you're punishing and doing, my God, practicing unfair practices for institutions, clinics that are trying to do the right thing, literally working to save lives, it's counterproductive. How can you be proud of putting excessive fines in the millions that would end up closing a clinic? And in this state where we are right now, when it comes to overdoses and the need for more mental health support and substance use disorders, this needs to be fixed right away, because we cannot afford to allow one more clinic, one more location to be shut down because of these insane fines and punishments for pennies. We're fighting for pennies today, right now in the budget, to make sure that we don't lose a dime when it comes to the services that we provide and services that New Yorkers need. So this is an obvious fix that I wish our governor would see, recognize, and support today, because we cannot waste any time. We cannot lose any more services, and the people of New York depend on it. Thank you so much to the partners, Pete Harcum, who's been an amazing leader on this, and my partners in the Assembly. Let's get this done. Let's save New York.
So I just want to, also talk about personal experience happening in my district. We have a reproductive health provider who does care. We as a state have given them millions of dollars. Just recently gave them $500,000 based on what the governor put in the budget last year. And now OMIG's trying to charge them $1 million for technical mistakes. So when we put money in the budget, because we wanted to go to reproductive care, and then OMIG's trying to take $1 million for technical errors from this same provider, which can risk this provider from closing down. It means people in New York State will not have reproductive rights. They won't have access to care. So OMIG reform is so critical, because this is just about technical errors. It's like the wrong name on a drop-down screen. That's all we're talking about. And so if someone made a mistake because someone put the wrong name, that means that agency, that nonprofit provider which provides this care, may close its doors. That can't be what OMIG is for. It can't be what we need. What we need to do is get this bill done, make sure that those technical things don't result in these astronomical fines, and protect the providers in our state. Thank you.
Now I'm really delighted to introduce Assembly Member Aileen Gunther, Chair of the Assembly on Mental Health. Thank you so much.
Thank you. You know, it's really strange. Why do we always go after the good people, really? I never understand it. These are people that are serving our population, and we're going after them and taking money away from people that really need help. So thank you for having me here to talk to you about such a worthy cause. This bill is a great step in making sure New York State's behavioral health sector has the support it needs to facilitate these much-needed services. As chair of the Assembly Mental Health Committee, I know the importance of holding bad actors accountable, while also unburdening those who act in good faith in the mental health space. This bill, carried by Assemblywoman Paulin and Senator Harkman, is a key in providing transparency and making sure that those service providers with the ability to help are not discouraged by outdated OMIG audit practices. Protection from fraud at the hands of bad actors is important, but that cannot come at the cost of providers who practice in good faith. Penalizing providers for making clerical or technical errors only hurts the state's effort in weeding out fraud. People struggling with mental health and substance abuse issues are often most disenfranchised and need the help and the services for ever increasing times. We encourage to make sure that these essential services providers are encouraged to help, not discourage, and this is very discouraging. Looking out for New Yorkers struggling with mental health and substance use issues is looking out for all New Yorkers, and that's why I will always advocate for those struggling, even when they cannot advocate for themselves. This bill plays a pivotal role in not only protecting our service providers, but also protecting access to services for our most vulnerable people. I will always fight to make sure that you heroes who provide care to people at their lowest are treated with equality and dignity that they deserve. We need to continue doing more in order to stifle the growing mental health crisis happening in our state and keep finding fair and equitable solutions. Thank you.
Thank you, Assemblymember. And now we're going to hear from one of our key supporters, Assemblymember Marianne Butenschon. Thank you so much for coming today.
Thank you. My colleagues have said it. We are not talking about fraud. We're talking about a clerical error that has been made. And clearly the process isn't working. Each one of these agencies are doing their due diligence and are in the same predicament that so many of us are in regards to not having the support staff they need at this time. So the hardworking individuals that are helping other New Yorkers are faced with many challenges, and to hear that they can't provide because of simple paperwork is ridiculous. So again, I thank everyone that is here today that does that hard work, that is a part of so many of these agencies that work so hard for individuals in need. And I stand with my colleagues. Thank you.
Thank you. Now we're going to hear from John Wegman, CEO of Angels in Your Home. That is, Angels in Your Home is a over 20-year-old program for traumatic brain injury, and John comes to us today from Rochester to tell his story.
Thank you all. Yes, our story with OMIG is, they come in, they've done a small audit, a small batch of review, extrapolated over the whole client base, which ended up being over $3.5 million. All of our professionals are trained and licensed professionals, and through that period of time, that is all the Medicaid funding for those, for that avenue for Angels in Your Home. So it was a devastating time through COVID, through that era of time that they recouped those funds. There was absolutely zero fraud. This was a human clerical error on a small batch of findings, and that can be devastating through the whole process. Thank you for my time.
Thank you, John. Now we're going to hear from Barbara Crozier, who is the Vice President of Advocacy and Government Relations for the Cerebral Palsy Associations of New York State. Barbara represents the Cerebral Palsy Association. It's a statewide association founded in 1940 representing individuals with developmental disabilities, family, and the staff.
Hi, thanks so much. I'm not going to repeat much of what's been said. I just want to reiterate that we all wholly support the OMIG's mission of combating Medicaid fraud and abuse. But after years of divestment from the prior administration, we are in the midst of a workforce crisis. DD Medicaid providers are already strained to the point of near failure in many parts of the state. The OMIG needs to recognize their current auditing practices are unfair and ultimately increase cost and or harm the people they seek to protect. No provider should be unfairly punished and treated with the same severity as actual fraud for making an honest mistake, often out of their control, in efforts to be paid for services, Medicaid services they provide. DD services are almost exclusively reimbursed by Medicaid. We have no other payers. We don't have commercial insurance or Medicare. So almost 99 to 100% of our claims are subject to OMIG audits. As a result, when a technical or clerical error occurs, such as a care coordinator putting the name of a day program instead of the agency in a life plan that is not the responsibility of the service provider, it's then extrapolated against the entirety of services. The impact can be crippling. One DD agency OMIG audit took 2 years of Medicaid claims, about $40 million. Payback started at $4 million, and they were fortunately able to hire a team of attorneys and fight the audit. And in the final process, they only had to pay back $30,000, which they said was a miracle. However, fighting the OMIG is costly and risky. The OMIG gives agencies the higher and lower confidence amount for payback. If the agency decides to fight the final audit results, the OMIG tells the agency that the lower number comes off the table and they'll have to pay back the higher numbers. One Medicaid provider called it legal extortion. We appreciate the sponsors, Senator Harcum, Assemblymember Paulin, all the legislators, and the Senate for including the language in their one House budget, and everyone who supports injecting fairness and transparency to the OMIG process, which will protect New York Medicaid services and vulnerable recipients who depend on them. We urge the governor and the legislature to include this OMIG reform in their final budget. Thank you.
That wraps up our event today. Thank you so much for coming. We appreciate the support of everybody who participated, legislators, providers, associations, advocates. Thank you all.
Thank you.